Good evening, I'm Richard Smith and I'm the chair of the UK Health Alliance on Climate Change, of which the Glasgow College is a member. And I'm going to be talking about what to expect from COP26. Right, well, the Daily Record, Scotland's perhaps most popular newspaper, has captured exactly the significance of COP26. It is the last chance to stop climate catastrophe. That's what the Daily Record says. And this is why it says it. So this graph illustrates the kind of temperature increase we can expect by the end of the century with different policies. And it may, I fear, be a little optimistic. So if we had no policies at all, if we just went on as we are now, and you can see that there's been a steady increase in greenhouse emissions, then we'd end up with perhaps a 4 or 5 degree increase in global temperature, which would be catastrophic. Even with the Paris pledges made at a previous COP, we're going to see an increase of nearly 3 degrees. And of course, it's one thing to pledge things, it's another thing for them actually to happen. So our current policies are pushing us towards an increase of something like 3 degrees. But what the world agrees, and a whole lot of editors of health journals made this point recently, we must do everything we can to keep the global increase below 1.5 degrees. And that is going to be a very tough thing to do. I think I want to say that since the Paris Agreement, if we were going to stay on target, we should have been decreasing carbon emissions by 7% a year. In fact, they've been increasing by 7% a year, making the aim of achieving an increase not above 1.5 ever more difficult. They did drop during the pandemic in 2020, but that's with much of the world economy shut down. So it shows how much change we have to make. And this is the underlying problem for COP. So if everybody in the world lived as people live in North America with their kind of carbon emissions, we would need 5 planets in order to meet all those needs. Even those of us that live in Western Europe, if everybody lived like us, we would need 3 planets. The only people who are living in a sustainable way are not everybody, but many people in the Asia Pacific region and in Africa. And of course, those people want to develop. They want the things that we want. So the only way that can be made to happen is if we drastically reduce our carbon consumption and emissions. That's the underlying dynamic behind COP26. Can we reach an agreement between rich countries, which have really caused the problem, and poor countries, which are already suffering the most? And Alex Sharma, who is leading COP26, and the British government has made it very clear that they want to keep this goal of keeping the global increase below 1.5 alive. And we, the UK Health Alliance, we have a policy that we've spent quite a lot of time calculating and thinking about of what we need to do to keep the global increase below 1.5. So we would need all countries to achieve net zero emissions by 2040. At the moment, the UK government target is 2050. It's better in England. Very importantly, we need countries with the greatest responsibility for carbon emissions, that's us, to transfer funds and resources and technical know-how and support to the most vulnerable countries. After the Paris Agreement, the agreement was that there would be a payment of $100 billion a year to poorer countries. That hasn't been achieved. And what has happened with sharing vaccines is not terribly encouraging. So we also want all fossil fuel subsidies to end, coupled with a massive investment in renewable energy and other green activities. And of course, the good news about all of this, if we were to do all the things we need to do to decarbonize our economy, we would be living in a much healthier world. We want all fossil fuel companies to become net zero by 2040. And we thought it important that their we make clear that we too, individuals and people working in health services, must have a target too. So we want all health services to become net zero by 2040. At the moment, the only two health systems in the world that have plans as opposed to targets to get to net zero are in England and Wales. Scotland, I know, has one in draft, and I think it will be produced very soon. But it's very easy to set targets. It's much harder to reach them. And this is the logic behind our program. We need to converge the carbon footprint of different countries, which are very low, mostly in low-income countries, and very high in high-income countries. We need to converge, and then we need to contract, so we end up back where we were before 1900, before the Industrial Revolution, in terms of carbon emission. And you can see, if you look at this map, you can see what each part of the world is expected to do. So the rest of the world may legitimately increase for a while so that they can develop. But we in high-income countries, so that we're included in OECD less USA, we must make a very dramatic reduction very quickly. And what does that mean for individuals in Britain? That's you and me. Well, at the moment, our average per capita emission is about 5.6 tons. The reality is that probably most of the people listening to this have a higher emission, because the richer you are on the whole, the higher your emission. So each of us must rapidly converge to the global average, which is about 4.8 tons per capita, and then reduce to zero by 2040. So what that means, if you calculate it out, is that the global share of carbon for each Briton is about 0.5 tons for each year between 2020 and 2040. So having to taper off very rapidly. But at the moment, the average British home emits 2.7 tons of carbon dioxide a year from domestic heating, all our gas boilers. And there are some 23 million homes that need to be changed. That's a very formidable undertaking. A return flight from London to New York emits 1 ton. So that's twice what you're allowed in a year. My grandchildren live in Mexico. I hope very much to be able to go and see them. That will consume more than a ton. So I think these examples illustrate the sort of dramatic changes we need to make in how we live, eat, travel, and work, and in our professional lives to keep the global temperature increase below 1.5. And I just want to emphasize that it's about everybody doing something at every level. I mean, governments obviously must take the lead, and if governments don't take the lead, we can never succeed. But it does as well mean all of us changing. So this is my last slide, and I hope you will play your part in change by changing how you live yourself, traveling less, flying less, driving cars less, exercising more, eating diets that are more plant than animal based. But I also encourage you to join our alliance. We have a letter that we plan to deliver to the delegates at COP26, calling on all of the things that I've just described. So hope to see some of you in Glasgow. Thank you. Bye-bye.